Now, let's talk about some things that might be normal in pregnancy, which may not be normal in normal person. If you see a normal person who is moving up and down, and eventually the legs are swollen, a normal person, not pregnant, a man or a woman, once the legs are swollen, we are afraid, because at that time, it's either we are having a kidney problem, or we are having a heart problem, or even a liver problem. Once you see extensively swollen leg, it simply means there is fluid retention. That means that that person is having more fluid than normal. And three major organs that can give us this condition is either it is the liver, either it is the kidney, or what? It is the heart in a normal person. But sometimes you can see massive leg swelling in a pregnant woman, and it is normal. Do you understand what I'm saying? So a pregnant woman might just come with leg swelling. It is not a time of going to take Lexis or taking any drug. Once the legs are swollen, we will just go and concentrate on the blood pressure. Once the blood pressure is good, we do the urinalysis. If there is no protein in the urine, then that is a benign swelling. It simply means that after the swelling is going to resolve on its own. Sometimes we might have a situation whereby the legs got so swollen at 5 months. By the time you are coming to 7 months, 8 months, the leg will resolve on its own without intervention. I don't know if you understand. So leg swelling is not one thing that by the time you see it in pregnancy, you start panicking. The way we panic in leg swelling in a normal person is not the same way we panic for leg swelling in pregnancy. There are so many factors that might explain that. But just at your own level, just know that it is not all leg swelling that are dangerous. As long as the blood pressure is normal, as long as there is no protein in the urine, leave that leg swelling. It doesn't require any intervention. We are not supposed to do anything. Is it clear? Another thing that we keep some people, sometimes a woman will come and tell you, doctor, I did a scan last month. They gave me 13. Last 3 months, they gave me 12. And this month again, they are giving me 8. Which one am I going to accept? We usually recommend 2 scans, a minimum of 2 scans. But sometimes, some women, we want to do the third one. We need at least 2 scans. The first one is supposed to be done before 20 weeks. I don't know if you understand. That one that is done before 20 weeks is the one that we will use to know the actual date of the delivery, especially for women that doesn't know their last menstrual period. You can see a woman now and ask her, what is your last menstrual period? She didn't know. Instead of telling you in confidence that she has forgotten, she will just quote one date so that she doesn't appear as if she's not careful. But if we do this scan before 5 months, we can know for sure when is the expected day. Now, another one we do is usually after 36 weeks or 37 weeks. We are not doing that one for the sake of the date. We are doing that one at least to know the position of the baby. Sometimes, if you do a scan when the baby is still 4 months, they will come and tell you that the baby is sitting down. That woman will start being afraid. Eventually, they are going to operate on her. But the truth is that sometimes the nurses will tell you, the truth is that most times, the child will turn on his own. It doesn't need intervention. It doesn't need any treatment. It doesn't need any... Forget about the position in 5 months. That time we send you for scan, we are not looking at the position. That position at that time is irrelevant. What is important that time is what? The position of the placenta. Sometimes the placenta that is even located will go up later. But what we are looking for in that early scan, number one is that we want to know for sure, depending on how early the scan was conducted, where is this pregnancy? Where is the baby developing? Because sometimes we might have an ectopic pregnancy that will up to 3 months or 4 months, developing outside the womb. So that early scan will tell us for sure, this baby, is it actually developing inside the womb or outside the womb? That's number one. Number two is that we want to know the sure, what is the expected day of delivery. That date is the one that we hold, because before 5 months, all the baby grow the same. After 5 months, then their rate of growth will change. Whether the mother is feeding well or is not feeding well, every child below the age of 5 months in the womb are almost the same. I don't know if you understand. So the people after 5 months, their growth changes. Predicting the expected day of delivery become difficult. I don't know if you understand. So those are the thing we do. You do a scan in 5 months, in 3 months, and the baby is sitting down. No problem. You do it in 4 months. In fact, in 6 months, the baby is sitting down. No problem. Allow this baby. Sometimes the baby will now turn on his own. There was a time we used to do what we call external cephalic version. It means that we try to turn the baby out, but most times the complications that are gotten from it is even worse than the CS itself, because I nwere ike nọrọ ebe anyị na-atụgharị ya, we might be trying to turn it and we will dislodge the placenta, and once we do that, we have placenta abrasio, which means that the placenta has separated even while the baby is in the womb, with its own complications. We can actually have a way where we will actually touch. Then the way you are touching, you will be stimulating the cord. You can stimulating the cord to the point that the cord will go into spasm and stop passing the blood to the baby. The baby can actually die in the womb while you are trying to turn. So most of this thing doesn't need intervention. See, pregnancy is such a natural thing that there are some things that God took care of why you didn't even know.